Warm welcome to a few of our newest SNMMI-TS fellows who were inducted in June of 2023. I was able to catch up with a few of these fellows and ask them a series of questions. I'd like to introduce you to Sarah Gibbons, Clay Nuquist, and Julie Bolin. So how did you all become interested in nuclear medicine?
Hello, my name is Sarah Gibbons, and I became a technologist section fellow in 2023. Like many of us, I learned about nuclear medicine late and by chance. I was on a nursing track and I quickly realized that maybe nursing wasn't for me. So I met with our academic advisor who had a list of different types of health professions, and I saw nuclear medicine listed. I didn't know what it was, but the name sounded cool. So I chose nuclear medicine, and luckily for me, I absolutely love nuclear medicine.
Well, I got interested in nuclear medicine via a happy accident. I was working at a pizza parlor as a waitress during my senior year of college, and I was just kind of spinning my wheels because I couldn't quite figure out what I wanted to do. I knew what I liked about my degree, but I didn't quite know how to apply my degree to an actual career. And I'd been able to rule things out, but not quite able to rule anything in. One of the gentlemen who started working informed me that he was going to school for nuclear medicine technology. I'd never heard of that, so we started having a conversation about what it was, what it entailed, and I determined that it pretty much aligned with what I loved about the education I was already receiving. So I looked up the JRC and MT and looked at all of the area schools and started making phone calls.
Well, unfortunately, it's going to date me. In 1980, I was working as an emergency medical technician in Palm Beach County, Florida, and we got a call to take a patient to a hospital that had just installed a CT scanner, and CT was just beginning back then. So while the patient was undergoing the CT scan, I went across the hall to nuclear medicine to look and see what nuclear medicine was all about. I talked to the technologist that was there, and he had just got out of the Navy after doing a 4-year stint with the Navy, and he got his training in the Navy, and he told me that the Navy had a really good program. My father was a retired Navy diving officer, so I was familiar with the Navy career, so I went to the Navy recruiter and talked to them about the nuclear medicine program.
Where did you all hear about nuclear medicine technology, and what certifications do you all hold?
I graduated with a bachelor's degree in nuclear medicine technology from Indiana University School of Medicine in 2016. I became dual certified in both nuclear medicine and CT through the NMTCB.
So I enlisted in the Navy in 1981 and went to hospital corpsman school as a prerequisite for nuclear medicine school. I spent about 18 months as an on-the-job training nuclear medicine technologist at Portsmouth Naval Hospital, and then I went to Bethesda Naval Medical Center to attend the nuclear medicine program and graduated in 1984.
Medicine technology and which type of school? I went to a hospital-based certificate program, Research Medical Center in Kansas City, Missouri.
When did you become a technologist?
In my 8 years in the field, I have worn many hats. I started as a staff technologist, became the hospital's radiation safety officer. I moved into a team lead role. I became an adjunct faculty member for the program that I graduated from. I'm now a full-time instructor with Gurnick Academy, while also maintaining my radiation safety officer duties and being a PRN technologist at the hospital where I started my career.
I spent about 18 months as a on-the-job training technologist, and then I became a certified nuclear medicine technologist in 1984.
So which certifications do you all hold?
I hold the Nuclear Medicine Technology Certification Board, CNMT, from 1984, and I have the Positron Emission Technologist, PET, certification ongoing since 2004. I also have a Medical Radiation Safety Officer certification and a Radiation Safety Specialist certification.
I hold the NMTCB CNMT certification.
What is your favorite part of the job?
My favorite part of my job is preparing students to become effective nuclear medicine technologists who are qualified and add value to our profession.
providing the highest of quality of care for my patients.
What future goals have you set for yourselves?
One of my future goals is to become a nuclear medicine program director where I can help our technologist workforce pipeline shortage.
With over 44 years of nuclear medicine experience, I have set goals and I have achieved those goals. Upon my retirement, I would like to seek out some of the nuclear medicine training programs within Maryland, D.C. area and see if I might be able to assist as an adjunct professor.
What does being a fellow mean to you?
Honestly, it feels like I got accepted into the cool kids club. I hold all of these individuals in such high regard that being allowed to call myself a fellow just means professional validation for contributions that I've made, and it's very, very rewarding.
To be recognized by the SNMMI technologist section for my 30 years of voluntary service and contributions to the profession of nuclear medicine technology is both rewarding and fulfilling. I am proud of what I was able to accomplish with the help of the technologist section.
So why are all you guys involved with the SNMMI? And what's your favorite part of being involved?
I'm involved in the SNMMI because of the value that it brings to our profession. They're our voice and help ensure that we have a seat at this big healthcare table. We are important. We need to be heard. We need to be protected. And the society helps make that happen. My favorite part of being involved in the society is not only the connections I've made and the wonderful people that I've met, but also being a part of protecting our scope of practice and supporting the value of licensure so that we continue to maintain the quality and safety in our field.
To demonstrate to the nuclear medicine technologist community the significance to maintain involvement within the SNMMI tech section through continued membership and participation on the local, chapter, national, legislative, and regulatory levels. My favorite part is advocacy. I like to be there for the technologist and to be able to do what I can do to support the technologist. Thank you.
I really think that the SNMMI is the leader in terms of professional organizations and being fully invested in nuclear medicine and molecular imaging. They are a driving force for innovation and research and development that promotes patient care and personalized medicine, but it goes far beyond that in terms of their advocacy initiatives, outreach and promotion of our field, career and advancement opportunities for students as well as technologists. I think that the SNMMI makes such valuable contributions to nuclear medicine and molecular imaging, and I really believe that it's the best thing that I chose to do as a nuclear medicine technologist in terms of my professional development. It's given me an opportunity to develop a wonderful and vast global network of individuals that I really think are influential or leaders in this industry, and it's been able to provide me opportunities that I can give back to my students and to my community. So thank you, SNMMI.
So not all the fellows could submit a video for this, but I'd still like to extend a huge congratulations to them for this amazing achievement, including Cynthia Brodnux, Jeffrey Curry, Gary Gallimore, Sarah L. Johnson, Matthew McMahon, and Virginia Pappas. Congrats all.